National health insurance has been on the table for many years, probably at least a decade. We've seen similar types of schemes unfolding with various degrees of success in America and the United Kingdom. Each country has its own challenges. The principle of national health insurance is very good. One cannot argue that a scheme that proposes to uplift the standards of the public healthcare system and also to increase its outreach into rural areas is not a good scheme and very necessary for the country. So there's no problem with the principle, but the problem has always been with the money. A couple of years ago, there was a rough estimate, and I'm talking 5 years ago, if memory serves me well, of 220 billion rand for this project, which is extremely expensive, and the country just cannot afford it. So while a worthwhile project, the Minister of Health, who's doing his best to make this thing unfold, has been hamstrung, one can say, by the finances behind it. Where we are now is that there has been a proposal made in last year's budget that the issue of medical tax credits would be reviewed. Medical tax credits is a rebate. In other words, it reduces the amount of tax, and it is granted in respect of contributions to medical schemes, and it's granted in respect of medical expenses at the end of the year, particularly for elderly people and for families with a disabled member. Then these credits come into play at the end of the year. But for normal employees who are members of a medical scheme, there's a rebate, there's a tax reduction around their contributions to the private medical scheme. Now, this has been with us in various forms for many, many years to assist employees to belong to a medical scheme for their own benefit. Okay. Now, if the medical tax credits are either done away with, hopefully not, or perhaps phased out, because the intention is to take the money saved from the medical tax credits and push it across to the national health insurance. But if that happens, then one can appreciate that employees who are able to possibly just afford their medical scheme contribution, which, you know, in our eyes is expensive, without that tax incentive, probably a lot of individuals will have to say, I can't afford it anymore. Leave their medical scheme, and then they have no recourse but to go to a public healthcare system. And unfortunately and arguably, areas of the public healthcare system are not up to standard. So in a way, doing away with the medical tax credits, which would move people onto the public healthcare system, is putting the cart before the horse. If the public healthcare system standards were at an acceptable level all around the country, then it would be a more acceptable choice to make, whether you want to belong to your medical scheme and whether you want to go purely onto the national health insurance system, the public healthcare system. So it seems premature. It's going to be interesting to see in this year's budget whether they do go ahead with a phasing out or perhaps a complete doing away with the medical tax credits. If they do, I think there's going to be a lot of public comment around it and a lot of opposition to that process.